Lobotomies, to me, just seeing them devastated me. I was a part of it. You have to remember that in the early 50s, there were no tranquilizers. Lobotomies were done for those patients that we completely had no control of. They were assaulting other patients, employees. We had over 16,000 patients here. If you looked at a patient 2 weeks after admission, they have already started to regress. And if you picture yourself in one room, you know, nothing to think about, just meals. You were told it's mealtime. You were told when it was time to go to the bathroom. That's how they existed. Well, lobotomies were the last resort. I'm sure many of these patients had been patients that were in camisoles, sheet restraints. They may or may not have gone through insulin shock. There were the cold wraps. You can remove a camisole. You can remove a restraint. This is a mechanical device. Lobotomy was not mechanical. Lobotomies are permanent.
Justin, can we talk for a minute?
Sure.
You want to sit up, or do you want to lie down?
Lie down.
Really?
Yeah. Feel comfortable now.
I remember on lobotomies, they'd bring the patient in. Doctor would be here, complete head shaved. They would take gentian violet and score the head. Novocaine would be injected, and the surgery would begin. The patient was fully awake. I remember as a young student, for that matter, I would be standing here, and they would, on the side, the scalpel, then they would use a little drill. And I remember, to me, especially as a young girl, I mean, this to me was absolutely terrible. Right? They would take a probe and insert. They did not know where they were going, but they were hoping that something would slow down the process of this patient.
Justin, what kind of treatments have you been given over the years?
Ambulatory insulin, insulin coma, electric shock, neurosurgery, and finally drug therapy.
And finally?
Drug therapy.
And when you say neurosurgery, what do you mean?
Brain surgery. I had a prefrontal lobotomy. 152 at New York State Psychiatric Institute and Hospital, 722 West 168th Street, New York 22, New York. Phone number Lorraine 84000.
And as slowly as you can, and as clearly, what happened that day?
The operation? We got a stretcher. I found myself being moved into a lighted room with 4 surgeons there. Baby Aronson, the Sapperman, the Pierce, and at the Ransonov. Then they started the operation. I passed out.
In 1949, when Stanley Gross was lobotomized at Pilgrim State, the treatment was seen as a cure for the most extreme schizophrenia. Although the operation did subdue violence, it soon became clear that the underlying illness was not affected at all. Stanley, we had been warned, never discussed his operation.
Follow him to it? No, he died, I told you about that time by the bomb dropping and boom, he flew the picture with a great big hole about 4 feet right in the ground. So it was a baby bomb, it was a major bomb.
Stanley, which planet should have come down to attack the Earth?
The planet of head breakers.
The planet of head breakers?
Yeah, they're 1 million miles up, so you know it takes about 2.5 days before they can land. Traveling 1 million miles an hour.
Planet of headbreakers, and Stanley's supposed to be the head of that planet.
What? Lord.
How many heads has Stanley broken?
What do you think? You remember?
Anything else you want to
The
tell
whole
me?
story. You see him break any heads around here?
Did I see them break any heads around?
Did Stanley ever break any heads in Pilgrim?
In Pilgrim State, did Stanley ever break any heads? No.
Okay, so
But let me ask you a funny question. Did Pilgrim State ever break any heads?
I don't know. I know this isn't a joke to wear 2 holes in your head. And I'll tell you something. I read on a bulletin that's put up that if a doctor did that anymore, he got fined $15,000 and to spend 10 years in jail. It's against the law to do it now. What do you think? A doctor wants to go to prison for 10 years and pay $15,000?
By the time lobotomies were stopped at Pilgrim State in the mid-1950s, over 30,000 had been performed throughout the United States. At that time, this now abandoned building was filled beyond capacity, a monument to the ineffectiveness of any known treatment for schizophrenia. The desperate search for cause and treatment continued. It further polarized psychiatrists already divided between those who embraced the principles of modern medicine and the promise of antipsychotic drugs, and those who held to the more dominant tradition of American psychiatry.